Cancer does not wait till the curve flattens. Cancer is not quarantined. Cancer and the risks of cancer and screening for cancer and living a healthy lifestyle have been with us way before coronavirus, through the pandemic, and now as we emerge in a safe environment here at Englewood Health, we need to pay attention to all aspects of cancer screening, prevention, and treatment. I want to assure you that it's safe to come back to Englewood Health if that means surgery for cancer, if that means getting chemotherapy or radiation. We have gone to extraordinary efforts to assure you that the entire cancer center is clean and safe.
So what's really different from pre-COVID is there's no one really in the waiting room. As soon as you walk through the infusion center, you're moved through rapidly through getting your blood pressure checked, vitals checked, and into a clean room. The idea is to maintain social distancing. The nurse will come to you in the room, get the final information and checks, blood work, and so on, and then move on to give you the chemotherapy.
Patients to the outside contours of the skin.
So for radiation oncology patients, we are, of course, very cognizant of the fact that radiation can limit patients' ability to fight off infections, and we're therefore that much more careful. We are just allowing people to come in, get their treatments, and go straight out the same door, and not really have to be exposed to anybody else.
Every patient that is scheduled for cancer surgery will be tested for COVID.
Even if it's stage 4, patients are curable with colon cancer. At the very beginning, we did slow down to make sure that we understood the facts, that we were taking the safety precautions we needed for our patients. But now that we have that understanding, we have the confidence that we can manage the patients, we can pre-screen, we can make sure a COVID-positive patient doesn't get chemotherapy. We feel very confident in treating our patients for cancer.
I think once people see that people are being careful and that we're taking real responsibility for what's been going on, making sure that people are safe, I think people are realizing that we're doing our best.
The last thing I want to say is that as we treat cancer patients, we recognize that they are a unique group of patients. Not only are they the most courageous and extraordinary individuals, but they are immunocompromised. So before COVID, we create an environment that is safe, where infection control is extraordinary, and that has persisted and become more apparent through this pandemic. I can assure you that every person who will ever care for you, who will touch you in your care, has only one goal in mind, and that's to create the safest environment to help you through your odyssey with cancer care.